Okay, welcome back to ACT Program Webinars for Healthcare Professionals. I'm Robin Geiger, Senior VP of Clinician Advocacy for Ingenovis Health. The CDC declared insufficient sleep as a public health epidemic. Sleep often takes the back seat among healthcare professionals in our current fast-paced work environment. This leaves us more vulnerable to experiencing burnout with an increased risk of mental health disorders and chronic illnesses. I'm excited to introduce our speaker today. Dr. Afolabi Brown is a triple board certified sleep medicine physician and pulmonologist. As a sleep medicine physician passionate about sleep health and recognizing the negative impact of insufficient sleep on mental health and wellness, she founded Restful Sleep MD, where she works collaboratively with families, professionals, and organizations to implement effective sleep health strategies, improving well-being and overall performance. She's a member of the American Academy of Sleep Medicine and the American Thoracic Society and has co-authored several peer-reviewed publications. She's a frequent speaker and member of several medical advisory boards. And it is my pleasure to welcome Dr. Afolabi Brown.
Thank you so much for having me. I'm so excited to be here, Robin. Thank you for this opportunity, and thank you everyone for joining. Good morning, good afternoon, good evening, if you're catching this on replay, and good afternoon to those of you that are joining. I'm going to share my slide, my screen now. All right. So again, thank you so much for coming and for joining today. My name is Funke Afolabi Brown. As Dr. Geiger said, I am a board certified sleep physician, and today I'm going to be talking about prioritizing sleep to build resilience. Okay. So as a way of introduction, I wanted to share a quick story. And this saying was by Sidney Zion, who was the father of Libby Zion. And what he said was, you don't need kindergarten to know that a resident working a 36-hour shift is in no condition to make any kind of judgment call, forget about life and death. And this was after the death of his daughter. And so who was Libby? She was a college freshman. And what happened was that she showed up in an emergency department in a New York teaching hospital and was dead within 8 hours. And what happened was that initially they had attributed her death to be an infection, but then found out that she actually passed away from serotonin syndrome. And this occurred because two medications were given back to back, which were psychiatry drugs that then triggered adverse reaction that led to her demise. And further investigation showed that the physicians that cared for her were actually sleep-deprived physicians who were in training and were not adequately supervised. And what this ended up leading to was this whole grand jury investigation that then started to push the thought that physicians were working for excessively long hours. They were sleep deprived, and as a result of that, it was affecting their ability to deliver good care. And 60 Minutes actually picked this story. And what ended up happening was that there now was sort of a law in the state of New York that said that residents could only work within a certain number of hours. And over time, the Libby Zion law was birthed. And with time came, the work hour limitations to 80-hour weeks for most trainees, as we know. So I think it's important to highlight this. Unfortunately, this was something that resulted in, the loss of a life, but then it really created an awareness of how much sleep deprivation was impacting not only physician health, not only health for people within the healthcare system, but also how it was potentially contributing to medical errors. And so over the next few minutes, my objectives are that at the end of this, you will recognize the effects of sleep deprivation, identify potential sleep barriers, as well as determine the strategies to be used to optimize sleep and also promote resilience as individuals as well as within the healthcare space. Now, we know that based on what the CDC declared, that insufficient sleep is actually a public health epidemic. And there's a lot of data that has shown that this is a real true struggle. And some studies have already shown that actually 37% of 20 to 39-year-olds report short sleep duration. About 40% of 40 to 59-year-olds report short sleep duration. And then when we look at adults broadly, about 35%, so over 1 in 3 adults report sleeping less than 7 hours in 24 hours. And I think what's even more unfortunate is that there have been studies that have looked at this and have shown that up to 100,000 deaths occur per year in US hospitals due to either medical errors that result as a result of sleep deprivation. So definitely this plays a huge role, and it's something that we should address. And so that takes us to our first poll, which is right up here. And listen, this is a safe space. This is just from a place of curiosity, but the question is, how many hours of sleep do you get each night on average? The first, less than 5 hours, 5 to 6 hours, 6 to 7 hours, 7 to 8 hours, or more than 8 hours. So I would love to know.
And I'll end the poll now. Oh, there's still entry.
Ooh, I love the spread. That's great. You are all in the right place. So it sounds like about 19% sleep less than 5 hours, 15% 5 to 6 hours, 42% 6 to 7, and 23% 7 to 8 hours. And no one currently sleeps more than 8 hours. So thank you so much for sharing. This is really interesting. And again, you are in the right place. Now, in terms of really how much sleep do we need, the National Sleep Foundation and the American Academy of Sleep Medicine have recommendations on how many hours of sleep we need. And that varies from individual to individual. And so what we do know is as newborns, we sleep a lot, our newborns sleep a lot more, our children sleep a lot more. And then over time with age, the sleep requirements decrease. But what you can see here is that adults are supposed to sleep anywhere from 7 to 9 hours. Now, this is a wide variability. And so the question is like, am I 7 hours? Am I 8 hours? Am I 9 hours? And usually what I recommend is the amount of sleep you need is typically within that ballpark, but the amount that helps you feel refreshed, that helps you feel well rested and able to perform your day-to-day functions. And why is that? Why is sleep so critical? Because it's not an option, it's a biological requirement of human life. And so as important as food, as water, as air, sleep is vital to our well-being and our health. And if you do the math, right? So I said 7 to 9 hours. So we're actually, depending on what stage of life we're in, we're actually sleeping up to 30% of our day and of our lives. And this requirement has actually not changed, even with evolution, with everything else. This need has actually not changed at all. And so the other thing that I wanted to point out is that sleep is socially driven, right? It is driven by so many factors. Apart from the individual factors, there are also environmental factors. There are, interpersonal factors, and then societal factors as well, which contribute to how much sleep we get. And, when we talk about that impact, again, not a cure for sleepiness, not something that's optional. Sleep is critical to our mental health, our physical health, our cognition, and also personal safety, because you and I would definitely not want to be sharing the road with someone who is a drunk driver, right? The same way we really don't want to share the road or be driven by someone who is sleepy and is drowsy driving behind the wheel. So it's a matter of actual personal and public safety. So now what happens when we don't get enough sleep? There was actually a recent position paper by the American Academy of Sleep Medicine and also the Sleep Research Society. And what they categorized the consequences of insufficient sleep into were general health, so including our cardiovascular, metabolic, mental, immune health. And I'm preaching to the choir here, even talking about that. They also talked about its impact on pain thresholds, immune health, human performance, increased risk of burnout, mortality, and cancer. So I would say that sleep really interferes with pretty much every domain of our lives. And because sleep is so pivotal and so critical to so many physiologic systems, insufficient sleep, poor quality sleep is also associated with certain chronic diseases. And so things like obesity, there have been studies that have shown that there are associations between sleep duration and increased weight gain over time. And there have also been studies that have also shown that these are even studies of really large studies, even meta-analysis. And what they've shown is that insufficient sleep is associated with an increased incidence as high as 33% higher risk of developing diabetes. And they've seen that sleep duration and sleep quality could be a predictor for higher levels of hemoglobin A1C. And then when we think about cardiovascular diseases, things like hypertension, stroke, coronary heart disease, and cardiac arrhythmias. And I think there's so much data now that's emerging that has shown that, sometimes when patients have or individuals have sort of poorly controlled, difficult to treat hypertension, and they have concurrent sleep disorders, managing and addressing their sleep disorders aggressively can lead to better and much more improved control of their blood pressure. Now, when it comes to sleep and depression, it's often a complex bidirectional relationship. So what comes first, right? The chicken or the egg? But that one thing we know is that if you have mood disorders, there's a higher risk of having sleep difficulties, and also poor sleep, chronic sleep deprivation, insufficient sleep, as well as sleep disorders is associated with increased risk of mood disorders. Now, when we drill down a little bit further, we've seen a lot of data showing that sleep deprivation can affect our work performance and can lead to cognitive slowing, including an increased response time, including increased risk of errors. It's been associated with reduced short-term memory, with impaired learning, as well as reduced insight. In addition, we've seen studies show that sleep deprivation is associated with decreased cognitive flexibility. Now, I think the issue is, it's one thing to know that you're sleep deprived, but it's even much harder to not even be aware of how much that sleep deprivation is affecting you as a professional in your day-to-day life. And so a few studies that have been done have shown that when you are chronically sleep deprived, you might actually have impaired situational awareness. And, they've actually looked at this where they had subjects that were exposed to sleep deprivation for a period of time and found that the same impairment they had was equivalent to the blood alcohol level that is considered as being legally drunk. So if you've been impaired where you've not slept for about 17 hours, the blood alcohol level, it was almost equivalent to a blood alcohol level of 0.05%. And then if you've been awake or been sleep deprived for 24 hours, that's pretty much at or even above the legal limit. So drowsy driving and drunk driving come very, very close in terms of the impact that it can have on our lives. And, imagine then that the errors of errors of commission could increased depression, anxiety, and mood disturbances, and then poor perception. That's one of the things, the fact that personal insight into these deficits could actually be really poor. Now, this review was published about, a few years ago, and what they looked at was the multi-dimensional association between occupational sleep loss, health conditions, and burnout. And so what they found was that the health effects, right, that were associated with sleep deprivation are actually quite similar to those of burnout. And so when you have burnout, and you have incomplete recovery from burnout, it actually can then mediate the relationship between having a stressful job or stressful employment, or just a perception of stress, which then can cause rumination. It then can cause a lot of worry, a lot of anxiety that can potentially contribute to insomnia. And so you might then end up with this constant vicious cycle. Now, I love this saying. We're going to be pivoting into sleep and resilience now. And this was by Arianna Huffington, and she wrote The Sleep Revolution, which is a really remarkable book. So I would encourage everyone to read it. And what she said is, exhaustion is a sign of chaos, not a badge of honor. And, I think we're at the point now where that narrative needs to change within the healthcare space. Because when you have a good night's sleep, it's really key to you to feel your best self, and even to help you to be the most resilient that you can. Now, what is resilience? Resilience is the ability to adapt and to move forward, even in the face of adversity, in the face of trauma, and regardless of stress that you're exposed to. And so this is a really valuable trait that really helps us to get through the challenges that we may get into in life, and also to bounce back from those challenges. So how does sleep impact resilience? There's been several studies. For the sake of this talk, of course, I'm not going to be going into those details, but what we do know is that consistently poor sleep can affect resilience. And that could be through creating an emotional imbalance. It can result in lack of empathy. It can cause poor impulse control and potentially risky behaviors, right? Anybody has ever had to deal with a sleep-deprived teenager? It can cause lack of creativity, and also, unfortunately, can lead to increased negativity bias. And so what happens in that situation? You're focusing more on negative events than positive events. And doing this chronically really leads to a poor perception of life, and poor and increased poor resilience. So now we've talked about a few things. We've talked about, how things could go really, really wrong when we don't sleep well, when we don't prioritize sleep. We've also talked about what the benefits of sleep is. It's really not optional. And we then talked about how sleep can impact resilience. So we understand this. I'm sure many of us, when we see patients, either directly or indirectly, we're saying, oh, how is your sleep? You need to sleep more. But then why is it that within our healthcare space, we're really not prioritizing sleep? And there's so many reasons for it. So there are 4 broad groups of thoughts that I had about this. The first is really the culture of our training. So if you think about it, usually during our training, intense, rigorous training, where we receive the message that sleep is indispensable, right? Sleep is dispensable, right? It's, we could get away with little sleep. You could survive on 4 hours or 5 hours of sleep, and yay you, right? And then over time, you've had your training, you're done with training, you now start to work these long extended shifts. And then we become desensitized to it. We don't even know that, sleep is so critical anymore, because we've become so used to really dealing with chronically short sleep over time. And also, in addition to that, there's competing demands. And some of those demands are internal, some of those demands are self-imposed, and some of those demands are imposed by society, the environment, the culture we're working in. So think about excessive documentation, right? Think about continuing medical education. Think about the inbox, right? And also the debt burden, which may then lead to working extended hours, which may lead to working extended shifts or moonlighting. And also on top of that, there is, just this entire narrative that we have within the healthcare space that really undervalues sleep. So many layers to this contributes to us really not prioritizing sleep. And then I also included circadian misalignment, which is a big reason why a lot of healthcare professionals do struggle with sleep. You may find out that, well, I try to sleep, but I'm not able to. Maybe you're a shift worker, and that could be any shift, whether you're working the graveyard shift, you're working a very early morning shift, you're a hospitalist, you're actually now at a point where you're working completely against your circadian alignment. And so that might be something that's contributing to sleep issues. And so knowing that, how do we move forward? How do we go from where we are now to where we should be? And so how do we prioritize sleep to promote resilience? I really think the first step is really looking at this from both an individual level as well as an organizational or structural level. And the reason why that is that there's been a lot of work that has been done looking at the, burnout literature. And there's actually been studies that have been done looking at the impact of promoting a workplace environment that encourages good sleep and seeing that it positively impacts the outcome of work that the employees do. Now, before we go recreating, I would recommend we start from what's already in existence. So the CDC actually has incredible resources that really provide some strategies on how to start to look at sleep from a workplace perspective. And they really address 4 pillars or areas of focus. And I'm going to talk at this from an organizational level to start. And the first they recommend is education, training, and assessment. And so healthy sleep initiatives should be introduced early within the medical curriculum. Now, things are a little bit better, but in training, at least in my time, maybe I got a total of 2 hours of medical training on sleep. So this was not something that we were even aware of. And a lot of the focus was on sleep disorders, not so much sleep health, which are 2 different things, right? And so having a system where these initiatives are put forth is really important. And then tracking the rates of fatigue and burnout is very important. And then making it such that adequate sleep as a critical pillar of health is included within educational initiatives is going to be key. And then the second is really encouraging opportunities for rest. And this may look different for different organizations, but having dedicated physical spaces where employees can rest, think Google, right, can help. And now the common misconception is, well, if you take a nap at work, especially if you have a long, if you have a long shift, if you take a long nap, then you're going to be groggy and you may have a hard time getting back into the routine. But studies have shown that even short 15 to 20-minute naps, especially for people that work extended shifts, will improve their performance, improve their alertness, improve their mood. And so at the end of the day, it ends up being beneficial. And again, this comes with really creating that change in our mindset about how we see sleep and how we see rest. Third recommendation they had was really creating systems to recognize fatigue and also incorporate safety measures. So what does that look like? It may look like implementing mechanisms where people feel safe to ask for coverage if they're too fatigued to work, right? Pushing through when you're really struggling, you're sleep deprived, you feel like you're really not able to perform at your optimum, but feeling shame because you maybe need a little bit of coverage, maybe you need to take a break, I think is really unfair on us as individuals and also on the people that we're providing care for. And also, I think one of the things they talked about too was being able to optimize the timing of interruptions. So who's on call? When are the pagers and the alerts going off? All these things I've had more than a few occasions where I'm not on call and I get a page in the middle of the night. You can imagine that going on constantly. And also even, there's some situations where things could, those interruptions could be limited to certain hours of the day where it's not disrupting sleep. And then, some basic things like optimizing workplace to improve alertness. So that looks like, adjusting the lighting. It looks like, making sure the temperature and noise conditions are optimal. And, they've talked about, when you have bright light, it actually promotes alertness. And so using that as a tool is definitely something that can be really helpful in improving work performance and also after work improving sleep. So here are just some other organizational interventions. This is one that's a little bit sensitive, but actually, if you think about it, limiting compensation that incentivizes extended work hours. I've had people who work 24 hours because, they get additional compensation. But then, I think helping to balance that is really important because of course, who doesn't want extra, right? To make that extra income, right? But not making this the norm. I think it's really important. And the other thing is offering flexibility and autonomy when it comes to our schedules. So if you have someone who's more of a morning person, having them, work late at night may not be ideal, but really allowing some form of flexibility and autonomy when it comes to creating schedules is going to be helpful. There are some people who are like, you know what, I could work the night shift. Meanwhile, some other people struggle more. And so really helping to create that balance, I think would be a great way to move forward. And then this is another one. I don't know who's heard of the death by 1,000 clicks, right? With our EHR systems. So reducing the need to engage with electronic health records at night, right? I've had people come and say, well, I can't sleep because I'm finishing my notes in bed, after the kids are asleep. But if we can build systems whereby our notes can be done during the day, right? Whether it's through scribes, whether it's through dictation softwares, whether it's through templates, all those things will improve our sleep duration and sleep quantity, as well as improve circadian alignment. So now we talked about the individual level, the organization and societal level. So for now, I'm going to focus over the next few slides on individual levels. What can we do as individuals? How can we take ownership of our own sleep? The one is to practice healthy sleep practices, and I'll talk about that in the next slide. That may look like setting boundaries, going to bed when it's better aligned with your circadian rhythm, avoiding drowsy driving, right? And also seeking professional help if you do need it. And I think that takes us to our next poll, which is really looking at what your main struggles are. I mean, from a place of curiosity, I would love to know. So if you could put that up. Perfect. So what's your biggest challenge when it comes to getting a good night's sleep? Is it difficulties falling asleep, trouble staying asleep, feeling groggy or tired upon awakenings, or all challenges apply to me?
I'll allow just a couple more seconds here.
Sounds good. Awesome. Wow, we got a spread all around. So difficulties falling asleep, trouble staying asleep, and all challenges applied to me are sort of the same, and then feeling groggy or tired upon awakening. And Absolutely, this is something that is really common across the board. And those three difficulties staying asleep, as well as difficulties falling asleep and trouble staying asleep, is really a sign of insomnia. Feeling groggy or tired upon awakening may be suggestive of sleep deprivation or could also be seen in insomnia. And so these are definitely very common. All right, awesome. So the next I wanted to really delve into is how do we then create those healthy sleep habits? Because a lot of times just working on those fundamentals will really set us up for sleep success. And so CREATE is just an acronym for healthy sleep habits. And so create healthy sleep habits starts with C, which stands for consistency. So having a consistent sleep time and a consistent wake up time. And this is a big, big deal, actually. And honestly, if you're like, I can't do all of these, I would say this one thing is so important. Because what happens is that when you have a consistent sleep time and bedtime, you're actually anchoring that internal clock or circadian rhythm. And so if you are as consistent as possible, where you have a consistent wake up time, 6 a.m., 7 a.m., whatever that looks like, even on the weekend, what that does is it reinforces your internal clock and helps you to be awake at the right time and helps you to feel sleepy at the right time. And so a lot of feelings of grogginess and tiredness in the morning sometimes can improve by just realigning that circadian rhythm. R stands for having a routine, and a routine is those calming activities in the direction of the bedroom. So having a shower, reading a book, doing something that relaxes you is definitely something that would promote good sleep. Ensuring that you have an environment that is cool, that is dark, that is noise-free, because all those interruptions can impact our sleep. Exposure to bright light in and of itself diminishes our melatonin production. And so what that ends up doing is it makes it harder to fall asleep. And then our core body temperature actually drops when we're falling asleep. And that's how we can get deep sleep. And so if your room is too hot, that alone might be something that you can fix to improve your sleep. And of course, if there's noise and things like that in the background, what that does is that it does interrupt the quality of sleep you get. A stands for assign the bed for sleep and sleep only in bed. Now, I think this is important to highlight because many times our bedrooms become our workspace, right? It becomes our desk where we're finishing up our charts or our notes. We're making calls, we're scrolling social media, we're watching TV, we're eating dinner, right? And so what that does is it causes these poor associations where our brains are not sure what we're supposed to do in bed. So when you get into bed, your brain is like, well, are we eating now? Are we watching TV? What are we doing? So reassigning your bed for sleep definitely helps reinforce that association. And then T stands for tackle technology. Now that's a whole webinar on its own because blue light that we get from technology, as well as the stimulating effect from our phones and iPads and TV, all of that impacts our ability to settle down, to wind down, and to fall asleep. And then E stands for eliminate. So what are the things you want to avoid before bed? Caffeine, because caffeine is a stimulant. It's a powerful stimulant, but then it can make it hard for you to wind down and sleep. Alcohol is a sedative, so it puts you to sleep, but it's rapidly metabolized by your liver, and so makes it such that you're waking up and you're having really fragmented sleep. And then exercise is very, very powerful for sleep, but exercise at the wrong time, meaning very close to bed, may actually contribute to difficulties falling asleep. And of course, if you eat a heavy meal before bed, first of all, if you have reflux or just the pressure of the food in your stomach when you're laying down is going to make it hard for you to fall asleep. Now, I just wanted to share a few tips for those who do work night shifts, because shift work we need our society needs shift workers, but then this is a group that really have difficulties with sleep. And so what can you do to optimize your sleep, even if you're a shift worker? The first is to protect your sleep as much as possible. This will come around setting boundaries. This will come around engaging your family to say, my sleep is so critical. If you're going on a shift, I usually will recommend having a pre-shift nap. And then as soon as your nap is done, maybe have a cup of coffee. So this is where I think of strategic caffeine intake. And then exposing yourself to bright light, because especially if you're going for a night shift, right, you're really moving at a time, or you're working at a time that's not aligned with when you should be working. So that bright light suppresses the melatonin and can help promote alertness. Now, how about when you're done with your shift? You want to just kind of do the opposite, because now you're going to go to bed, you're going to go home and sleep. So you want to avoid bright light before towards the tail end of your shift, right? Because we want that melatonin to slowly try to rise. You want to go home with the biggest, most bogus, ugliest sunglasses. It doesn't matter, because we want to avoid any natural light from coming in. And then, practicing healthy sleep habits, making sure your room is really, really dark is going to be very critical. And in some situations, you may need to take melatonin. And so this is one situation where I would say that is absolutely okay. So what else can we do? So one of the things we have to realize is that healthy sleep habits start during the day. So what does that look like? It looks like exercise. Exercise promotes deep sleep, improves your mood. It looks like mindfulness. So what are you mindful? What are you mindful of? What's on your mind? If you're going to bed and your mind is racing, if you're going to bed with a lot of anxiety, a lot of worry, addressing those things before going to bed is going to promote healthy sleep. Eating healthy, right? Green, Mediterranean diet has actually been associated with improved sleep. So avoiding, high carbohydrate, sugary, fatty foods, and really looking more towards the greens and things like that will optimize your sleep. And then living in community, because what that does really, again, is boosts our emotional health. And that in turn can help us sleep better. I get this question a lot. What about melatonin? Melatonin has some clear benefits in certain situations. But first of all, what is melatonin? It's a natural hormone. It's produced by the pineal gland. It really does influence our light-dark cycle, and it helps facilitate transition to sleep. So it's not a sleep aid. It's not a sleep pill. It's marketed as a supplement. So it's not FDA. It's not FDA regulated, but it does have certain benefits if you have jet lag, if you have delayed sleep phase syndrome, and then in some cases, if you're a shift worker. But it's not been shown to be very beneficial if you're struggling with insomnia. And so, when you look back and you've done all the healthy sleep habits, you've optimized your sleep the best you can, your healthcare, your organization has supported you optimally. Don't forget that there's certain sleep disorders that need to be addressed as well. So things like insomnia, which is the problems a lot of people have, difficulties falling asleep, staying asleep, and early morning awakening. The gold standard treatment for insomnia is what we call cognitive behavioral therapy. But I would say even before you get there, right, there's some practical things that you can do to help improve your sleep from that standpoint. Again, those healthy sleep habits are important. Practicing mindfulness if your mind is racing at bedtime, doing some deep breathing exercises, avoiding the alcohol and caffeine and things like that. All those things can improve your sleep just from a practical standpoint. But if this is a problem that's been going on for 3 months or more, you definitely want to reach out to your healthcare provider or to see a sleep specialist. Sleep apnea, pauses in breathing during sleep can also affect your sleep negatively. Conditions like narcolepsy are not as common, but they are existent, especially if you're getting enough sleep and you're still exhausted. It might be a sign of narcolepsy. Again, delayed sleep phase, or what we call circadian rhythm disorders, where you're almost like a night owl chronically. And so because of that, you're just not able to sleep at the right time. And you just almost like feel you have this burst of energy at midnight. But then if you're given the right schedule, you're actually okay. You don't have any sleep issues. And then parasomnias are things like sleepwalking, sleep talking, all those things can actually negatively affect your sleep. Another one is restless leg syndrome, or what we call periodically movements, where you have this creepy, crawly sensation in your legs that makes it very, very hard for you to sleep. And then, we have a whole host of other sleep disorders, as well as medical disorders that can affect your sleep. So if you have asthma, if you have reflux, if you have diabetes, right, heart failure, all those things can definitely, fibromyalgia, all those things can definitely affect your sleep negatively. And I'm going to end on this because I think of everything I've talked about, we need you to be safe. We need you to be safe on the road. We need you to be safe when you are caring for patients, and we need to keep you alive. And so know the signs of drowsy driving. And this may be so subtle, but things like trouble focusing on the road, difficulties keeping your eyes open, nodding and eye blinking, right? You may pass, an exit and you're like, wait, what just happened, right? Yawning, veering off the lane, closing your eyes as stoplights. And this may look like maybe just pulling over into a gas station and taking a 5-minute nap. This is something that is so, so critical because there's a high rate of mortality that exists with drowsy driving. And I'm going to end on this note, which is that you and I have a responsibility to ourselves, to our families, to our co-workers, to our organizations, to our mission to get enough sleep. And so again, I just want to thank you all for just being here. Thank you so much for your time. And thank you again for having me. I'm gonna stop.
Thank you so much. So it was really nice to have you here. There are a couple questions for you, Dr. Afolabi Brown, and there's a comment or two. One is, I guess there's something in your presentation. Those are pretty trees, good points here to start planning for sleep early. So this participant named Emma, she's going to start planning for sleep early. And then another question was, is it better to take something for sleep, like medicine, instead of lose sleep routinely?
That's a really good question. When it comes to, supplements, usually the way this starts, when it comes to the medication world, most people will start with maybe, melatonin or some natural sleep aids that you'll get over the counter, Benadryl, Tylenol PM, melatonin, valerian root. There's so many out there. And then eventually we'll start to upgrade towards maybe some medication, Ambien, Trazodone, so many others. Now, I think before we go down that route, one of the things I always recommend is ask yourselves why. What's going on? What's my why, right? So we talked about different reasons why you might not be sleeping. It might be stress and anxiety. It might be insomnia. It might be a medical sleep disorder. And so if you have just a short-term problem where, I don't know, you travel, there was stress in your family, there's something major that happened in your life, and you have what we call short-term insomnia, it's okay to use a sleep aid. It's okay to use that temporarily. But if this is a problem that's been going on for weeks, for months, where there's really no end in sight, it's time to pull back and say, where are we going with this? So if you're struggling, if you have chronically short sleep, is it because there are boundary issues and you're working so much that sleep has been squeezed out? Then the fix is not sleep medicine. The fix is, how do we create opportunity for you to sleep? If you're someone who has a sleep opportunity, but you get into bed and your mind is racing, then that's where we need to address, like, why is the mind racing? Again, is it stress? Is it boundaries? Are there things that we can put in place? Am I anxious? Do I need therapy? Do I need to work on those aspects before, and then we'll deal with it. And then if this is chronic, technical, like clear definition or clear-cut chronic insomnia, then that's where we start to say, okay, we need to start to get you set up either to see someone for cognitive behavioral therapy. And one thing I would say is, yes, it's hard to get access to someone who is an expert in conducting or performing cognitive behavioral therapy. It's usually a 6 to 8 week program where you're dealing with mindset, behaviors, and other things that are affecting your sleep. But there are lots of tools, there are lots of books that can help on CBTI. There's some apps like CBTI Coach, which is great. It was actually made for the VA because, veterans struggle with sleep issues a lot too. So those are good, practical, easy places that you can start. And then if you do need help elsewhere, then absolutely reach out to your physician or your healthcare provider to help connect you with the right resources.
Thank you. And I think you have a couple other comments. Thank you. It was very informative. Really enjoyed the presentation. Thank you so much. A couple will be contacting you. And then I have from an employee standpoint, what are your recommendations to raise awareness, identification, and to initiate active support and help for employees in healthcare settings? And I'm thinking this is in regarding sleep.
Yeah. Oh, that is an absolutely fantastic question. And I think that is so forward thinking, which is why, again, addressing these issues, when we look at it, there's a model that has looked at this, how sleep and our society and our community and environmental factors all intersect. Because you as an individual may have the best intention to prioritize your sleep, to live healthy, to eat green, to eat, all that. But if you are in a place where the culture does not support good sleep, does not support boundaries, does not have clear cuts, especially with the pandemic where people are working remotely, you don't know where your workday starts or where your workday ends and your evening and me time starts. So having a system, advocating, reaching out to leaders of organizations to start to see sleep as a tool that can enhance employee work performance. And, for the sake of this talk, I couldn't really delve into some of the data that has emerged from the cost of insufficient sleep on a global scale. In the US, it's the highest. They created these macro models from like really big countries like Japan, Great Britain, Canada, a few others. Annually, when they created these models, US is losing up to $411 billion in terms of the economic burden from poor sleep. And what that looks like is, it's the equivalent. So employees calling out sick because guess what? They have diabetes. And so their diabetes is somehow maybe related to their sleep, or they have infections, or they're just so fatigued and so sleep deprived that they're just not able to sleep well. I'm sorry, yes. And so as a result of that, they're calling out sick and things like that. So it's actually a tool that can enhance our workplace if it's used right. And having the right key stakeholders in the room to discuss this and to come up with those strategies, like some of the ones I gave with the 4 pillars, I think is really important. And, if you're looking for how to go about this, I'm definitely more than happy to help.
Thank you. And you do have another question. And if there's additional questions, you could always send them, contact Dr. Afolabi Brown. You could send them to act@ingenovishealth.com and we can make sure that she gets those questions as well. But we do have time for one more. And this is, I live where there is a lot of nighttime activity. It has become urbanish in my neighborhood. So sometimes it's impossible to sleep all night long. I use earplugs, nightshades, and try to limit the noise, but sometimes it's unavoidable. Once I wake up, the mind works on answers to questions that are ongoing in life. What else can be done? So
that is a struggle. And I definitely want to applaud you for making all those efforts because yes, you're right. Earplugs will help. Blackout shades because the light pollution is a big deal. Another thing that you might consider, depending, maybe things like a noise machine, a white noise machine. Or what that does is it plays continuous noise. And it turns out my kids just showed me the other day, Alexa plays it. So if you have Alexa, you could just use that. I'm just saying, Alexa. I know, right? I learned it from my teenage son. Right. Alexa, play white noise for 8 hours. And what it does is it kind of masks external noises. Again, it's not perfect, but it's definitely something else to try. Blackout shades, sometimes that's definitely something too that can help. And then I would say, in response to the question of like, what happens when my mind is racing? So remember when I talked about, when we're talking about create healthy sleep habits, A is assign the bed for sleep. So when your brain gets into this state where it starts to spiral when you wake up in the middle of the night, it means your brain has started to associate being in bed with worry, being in bed with being anxious. So we have to reassociate it. So what do we do in that situation? If you're in that situation where you wake up in the middle of the night and your heart is pumping, you're stressed out, you woke up and you're having a hard time falling back asleep, get out of bed, especially if it's been about 20 minutes, you're tossing and turning, you're feeling really restless. Get out of bed and go to a quiet area and just relax and do something you enjoy. So that may be reading a book that's boring. Of course, you don't want to do something that's exciting. You don't want to go on your phone, absolutely not. But just really finding an activity that helps you sort of unwind. Sometimes it may be breathing, it may be doing some breath work. Sometimes it may be doing like arts and crafts, putting a puzzle together, whatever that looks like, that helps you calm down, so that once your body feels calm and your brain feels calm and you start to feel sleepy again, you can go back into bed.
Wonderful. Thank you for that question. I think we did well. There again, I will type our email address as well, and so that you can forward those questions. Sound like I'm pecking, right? Let me send that. Okay, act@ingenovishealth.com if you want to get in touch with Dr. Afolabi Brown. She also gave her contact information, so you can reach out to her on LinkedIn, and her email or her internet website is Restful Sleep MD. It has been a pleasure. Thank you for guiding us through helpful tips and information to get better sleep. I know I needed that. We really appreciate your time.
Thank you so much. I really appreciate it.
Thank you so much. And for our attendees, until next time, thank you for joining us.